Alright. Hello.
I'm ready for vacation.
We're gonna wait for Whitman-Walker, the representative, to join me. I'm gonna figure out my lighting, hair, aesthetic situation. Pull my notes up. Drink my drink. Oh, what happened? Why is it black? Fixed it, I think. What's up, folks? How y'all doing? Hi, Paul. Hi, Mectis. I'm about to start a live with Whitman-Walker. Here we go. I'm good. How are you?
Hello.
Hi.
How's it going?
It's going good. How are you?
Oh, doing my best. I think that's what we're all doing, right?
Yep.
I love your hair.
Thank you.
Well, how long has it been like that?
Only since Friday. So
it's new.
Yeah.
Okay, let me turn another light on. Give me a sec.
Okay.
That would be better.
Yeah, I think that is better.
Yeah, that looks better. I've been working on my computer all day down here, and I'm like, I had to turn the lights off earlier because my eyes were getting tired.
Yeah, I can relate.
Right?
Yeah.
So what else have you been up to?
Nothing much. We were just working and getting to know each other earlier with the other art educator and
Cool.
Ruth, and talking about what we want to see in the corner once we get back in there. So
Awesome.
that was cool and productive.
Yeah, I've clearly been doing a lot of work with all of these things, which we're excited about. Yeah, just trying to stay sane. I feel like I'm taking it day to day,
Yeah.
Probably just wait for some more people to join on here since it is just 6 o'clock right now.
Yeah. Have you gone into the office at all?
I have not been in the office it's been about a week and a half now that I haven't been in the office. I've been very busy with social media stuff, so we've had some people coming in the office, especially people who are doing helping with the respiratory clinic, which we'll get to a little bit later. But I have not been in the office since not last week, the week before. So
good. At least you're limiting your exposure.
That's the plan. Yeah, we're doing what I think what's best for limiting exposure for community public health workers, but still trying to help our everyone who we serve as well. So
yeah.
So we can get started, right?
Yeah.
I got my notes pulled up here too.
Hi, everybody who's sending waves. Thank you for joining us.
Greetings. Yes, greetings, Roderick. For sure. Thanks for joining us. We are super excited to have everyone here today because we'll be going through a lot of information, some stuff from questions that people have asked us over the last few days, people have asked us today, and we'll be talking a lot about what Whitman-Walker has been doing in response to the COVID-19 pandemic, since that is always changing from day to day also. So we want to make sure we're giving you guys the most up-to-date information too. So do you want to start introducing ourselves, I guess? So should I ask, who are
Yeah.
you?
Hi, everybody. My name is Sol. I am one of the social media influencers, and I'm also one of the art educators for The Corner, which is the new cultural center that Whitman-Walker is opening. So hopefully you guys will come and get to interact with the space when the pandemic is over and the risk is not as prevalent.
Yeah, definitely. I've walked by the corner so many times since that's exactly where I work, but I have not gotten the chance to go inside yet. So hopefully, once everything gets a little better, we'll be able more people can pop in there because I've heard nothing but amazing things about it.
Yeah.
Um, but my name is JJ. Hello. I work in the community health department here at Whitman Walker. So I am our social media outreach coordinator. Basically meaning all these incredible sessions that we've started doing. Well, we've been doing them weekly now for a couple of months with Sol, who's one of our influencers, and a few other people. But we've also started to do these daily since we want to still make sure that we're reaching all of you, all of our audience, all of our family, Whitman Walker, making sure you're getting educated about your health and educated about what's going on in the world and what the pandemic is like. So we'll be coming to you much more often, and there'll be a lot more faces coming to you soon too. Um, I'm also gonna make sure I'm gonna type a little comment so that we can pin it on our thing. So since everyone who tunes in can know what's going on, you know.
Yeah. So if you guys didn't see our previous posts and you're just tuning in and you have any questions that you want to ask about COVID or about what Whitman Walker resources are still available and how you can get in contact, just make
Mm-hmm.
comment and we will do our best to answer them.
Yeah, for sure. Definitely leave the comments. We'll be monitoring them as best we can. Almost done here. I feel like the weather's been very up and down today. There's one window that's right in my room here, and I feel like it's been like either super sunny or it's been like dark out today.
Yeah, the clouds today are strong. They're pretty full, but it's nice out. The weather is not as bad
Yeah.
as it had been before.
No, how do you pin something to our chat here? Can
Uh,
you do that since maybe it's yours?
oh yeah, there you go.
There you go. Nice. There we go. Cool. Yeah, just so everyone tunes in, knows what's up, what's going on.
Yeah.
Cool. So do you want to talk a little bit first about like what community health department is doing to kind of like still do outreach even though we're mostly doing it online now?
Yeah, so even though the health, most of the health services are being done through telehealth, we've expanded our outreach efforts to social media. So all of the various topics that we cover with HIV, STI, sexual health practices, access to care, social determinant of health, and general public health interventions, things like that, we're going to be doing that through social media. And the next series of outreach sessions will focus on the current pandemic, which is COVID-19, and ways to manage your sexual, personal, and mental health during this time. So, our team is going to be here to educate and support you guys through this circumstance.
Definitely. Yeah. I think what we're trying to do, and we're obviously learning step by step, is just keep having like open conversations with people about what community health is doing for everyone, and just being really transparent about the information that we have. So kind of going off of that, we had a live yesterday. Will and Marshawn were on. Hopefully some of y'all tuned into that too, since they did an awesome job talking about safe sex during COVID-19. And there were a couple questions that were asked during that live that we just didn't get to because, sometimes you guys were commenting a lot and we can't keep up 100%. So I just wanted to make sure that we still covered those things before we kind of dive into the questions that you all submitted for the past few days. So the first question that we got was someone asked kind of about, so the topic obviously was safe sex and COVID. So these questions are related to that. So one person asked about what a risk would be like having sex with a partner, like a long-term partner during this time right now. So I would say it's what we always try to do is frame things in terms of like your own risk and how you can reduce your own risk, right? So if you and your partner are distancing together, maybe you're living in the same house, in the same apartment together, then having sex with your partner is I would say, a very normal and safe thing to do in that circumstance, since you're really not expanding the circle of people that you might come into contact with. It's just you, it's your partner having sex, then you're not going to like increase any possible exposures in that instance, right? But if your partner, if you don't live with your partner, if you have to travel to see your partner, then you are increasing your risk, right? Because then you're going out into the world where you can run it, like walk by some people. If maybe you're walking to see your partner, or if you're taking public transit, obviously you're running into people, things like that. So that definitely increases the risk for both you and your partner once you do get together. So I would say if you're having sex with a partner, it's definitely best to do it with someone who you're living with, who you're like distancing with in your house. And then if you are going to go see a partner somewhere else, it'd be good if you could like drive there, because that kind of minimizes your risk in terms of like, you're not walking in the outside world as much, you're in your car. But also keep in mind all the stay-at-home orders that are out there in Maryland, DC, Virginia, and make sure you're abiding by those as well. So just some things to keep in mind about that. Um, did I cover everything there, Soul? Yeah.
Yeah.
Cool. Good. Just want to
And
make
it
sure.
also covered some like creative ways to like have sex with your partners if you're not able to be with them physically, like phone sex and FaceTime sex and like masturbation together and things like that.
Yeah, definitely. I know one big thing
Next
that
intimate level without
mm-hmm,
physical.
definitely, yeah. So you can do over the phone, over FaceTime. Um, Obviously, uh, we're using protection like condoms, things, dental dams. I'll have a little demonstration later on of actually how you can make a dental dam even if you don't have one. Since we got some information about that and some questions about that too. So yeah, definitely a really good session. We'll have more like that coming forward. And then the other question that I got that we wanted to make sure we answered was about drug users in COVID-19 and how is it that drug users could be at an increased risk and increased harm of getting COVID-19. Um, and again, I think it's just about risk reduction, right? So you can use some of those same techniques that Sol and I just talked about, that Marshawn and Will talked about yesterday. Things like avoiding kissing because the virus has been found in saliva, using condoms and dental dams, limiting the amount of partners that you have if you are, like using drugs possibly, but then still having sex with people, like limiting your partners is a good way to do things. And of course, being hygienic, washing your hands both before and after sex. And we also are dedicating a live on Monday that AJ King, one of our mobile health coordinator, actually, our mobile health supervisor, excuse me, he's going to be talking about COVID-19 and like drug use, the opioid epidemic going on. So on Monday, so definitely tune in for that if that's something that I think that's going to be a really cool topic that he'll be talking about. So I think it's time. Should I do my demonstration? I think it's time.
Yeah.
Oh, wow.
Oh, also, remember to wash your sex toys as well with water and soap.
Yes, for sure. Water and soap, 20 seconds, same as you're doing with your hands, right?
Right.
All right, so with this demo, yesterday Will was gracious enough to explain how if you don't have a dental dam, and what a dental dam is for people who don't know as much is basically it's like going to be a barrier between like a body cavity. So you would put it like so it's between someone's anus and someone's mouth, for example, if you're doing like rimming or like someone's vagina and your mouth, things like that. So there's like a physical barrier between those so that it prevents HIV and STIs. So Will demonstrated how to make one of those with a condom if you don't have an actual dental dam. So basically, you like cut it, folded it out so it becomes one. But saran wrap is also a really good way to follow one to make one at home if you don't have one. So I have some nice good plastic wrap here. I think it's from like Walmart or something. So there you go. You take it basically. I would say like it doesn't need to be too much. It's just like a nice rectangular sheet. Rip it off. Nothing crazy you have to do here. And then I think it's probably good practice just to kind of like fold it in half here. So I have it kind of laid out and then just like fold it in half so that like flatten it out, make sure there's no as flat as possible. And then you would basically just put that like on whatever cavity that you would then like put your mouth to on somebody else, right? So you could put it on someone's anus, you could put it on vagina. And the other important thing to use, I would say, is lube, definitely is the situation. So this is some water-based lube right here. I would say you can definitely put the lube on like the inside because putting the lube on the inside will definitely make it a lot more comfortable for the person for who's like the person that you're putting it on, right? You can put some on the outside too. There's definitely no harm in that. And if you have flavored lube, I would say it's like an awesome, great opportunity to use one of those too, because then it'll taste good and everything. So I think that's another good demonstration. Just saran wrap, lube, you're set to go.
Thank you.
Oh, of course. Sol will be doing a demonstration of her own washing her hands later, so she'll get in on the action too.
Yeah. Some other questions that were submitted in from the previous lives were, can two people who have been quarantined 2 weeks together be safe to meet? Oh, let me rephrase. Can two people who have been quarantined 2 weeks be safe to meet and self-quarantine together?
So I think since it's been 2 weeks, so 2 weeks is basically the time that the CDC says that if you have been exposed, 2 weeks is like the maximum amount of time that symptoms could develop in. So if it's been 2 weeks and no symptoms have developed, basically you're good to go from 2 weeks like before then. So I'd say if it's been 2 weeks, then it would be safe to quarantine together. But keep in mind, and like what one of the two of you would have to then like go from one location to the other, and that could increase your risk of being exposed. And once you are together going forward, then like every possible exposure that one of the two of you has would then put the other person at risk as well, because you're kind of like, instead of just caring about yourself, you also have to keep in mind like all the possible encounters that the other person has now too, since you're living in the same space. So I would say it's definitely you then entering the space of the other person is not going to put at risk that other person in that like first interaction, but like going forward, it could increase the risk. So again, obviously, if it's like a partner and you want to like quarantine together going forward, like by all means, that's you're totally at your own discretion to go and do that. But again, just think about the risk that's involved with everything that you're doing.
Yeah.
So I have another question that was asked, so you can answer this one, Sol. Has there been any info out there that once you have had COVID-19 that you can't get it again?
So the short answer is that we don't know. But from the CDC, the immune response, including duration of immunity to SARS-CoV infection, is not yet understood. So patients with COVID are unlikely to be reinfected shortly after they recover, but it is not known yet whether similar immune protection will be observed for patients with COVID-19.
Yeah.
So still doing the research. This is something that is very new to a lot of the health physicians.
Yeah, exactly. It's like this is a new disease that we haven't seen yet before. It's similar to a few things that we've seen in the past. So like things like SARS, things like MERS. So in the case with MERS was that found out that shortly after people are reinfected, they have immunity. But it just hasn't been long enough, and we don't have enough data yet to decide if that's true or not. So definitely, hopefully, and that, like how the body's immune system works is that it's very likely that you would have basically like the antibodies in your system that would then recognize COVID-19 again, and then be able to like fight it off much more easier than the first time, since the first time your body's never seen anything like it before.
Mm-hmm.
So hopefully it's looking good, but we're still not sure.
Yeah.
Yeah.
Another one of the questions was, when did Whitman-Walker Health Clinic begin?
So I guess I can take this one for sure. It began in 1973, so we've been around quite a while. It started off as the Gay Men's VD Clinic, and VD stood for Venereal Disease Clinic, which was just now it's kind of an outdated term for like a sexually transmitted disease or infection. It actually started in the basement of the Georgetown Lutheran Church, which was crazy to me that it started literally in like a church basement somewhere. But we actually have a documentary that was released only a couple years ago that documents our entire history, called Fearless at 40, the Whitman-Walker story. And it's on our Facebook. So definitely check it out on our Facebook. It's under the video section on there. It's an hour long, super informative. I mean, people have tons of time on their hands now too, watching Netflix, watching like Tiger King, all those things, right? But definitely I would say check it out if you're more interested in learning about what Whitman-Walker's history is about. So the next question we had is, how does someone get a social media influencer position at Whitman-Walker? Does our social media influencer want to talk about this possibly? How maybe have they got involved?
I would say the first step is just to volunteer for like one of our events, get to know the
Mm-hmm.
staff, and like show that you're willing to help Whitman-Walker like execute their mission. My introduction into Whitman-Walker had been through Dwayne Lawson Brown, who's also the Crochet Kingpin. He's a open mic host and poet and things like that. And we had worked together, like not worked together formally, but we had done open mics together and things like that. And he always invited me to Floetic Friday, which is the youth open mic on the South Side in Eastern Market. And I had been going to that and
Mm-hmm.
offering to host and offering to perform at any Whitman-Walker events and things. So that's how I, weaseled my way into Whitman-Walker. But like I said, it's really just volunteering and showing that you're like willing to help and use your platform to help them execute their mission. Right now, they're not looking for, they don't have any open positions, but if you're interested in the future, we have an email that I'm not sure if I
Yeah.
can send two comments on here, but I'll try. If not, I'll just put this one back up.
Let me
But
see if I can do it too.
it's RKEITA at whitman-walker.org.
Yeah, that's it. Yeah, Soul's been super involved with one of our Floetic Uptown events that goes on all the time. So I would say definitely getting involved with events that Whitman-Walker has. We'll see your face. And if you are interested, you can always, here, let me see if I can drop it here. Did it come up there? Let me see. No. And then we also did get a question about different volunteer opportunities at Whitman-Walker. So right now, I would say there aren't that many volunteer opportunities with us, since people are supposed to be staying home, doing those kind of things. But there are tons of ways I think you can help out. So we are always looking for donations. That's a great way that if you are financially able, I know these are really tough times for a lot of people, but if you are able to support us, we greatly appreciate that financial help right now. In addition, there are, I think, just tons of ways to get involved and help out, with like donating PPE, donating food and groceries, things like that in your communities. So I would say like look out for those types of information. And as volunteer opportunities do come up and as those resources do come up, we'll definitely communicate those to on our social media too. So make sure you're following us, and those will be out there. And we also got a question, are they for all ages? Yeah, totally. We have a ton of youth events going on, I know, all the time. So I think that's like the only one that's more geared to a certain like age group demographic. But all ages, yeah, of course. The more the merrier.
Yeah.
Here, let me see.
Um, Another question that we had from yesterday was, are the mobile testing vans still out testing?
So, as someone who did a lot of work on the mobile testing vans, I can say they are not, unfortunately. Oh, there we go. Finally, my comment showed up. So that's the email address. It's Arkieta. Rama, who's one of our managers, said to email her if people are interested in becoming an influencer at any time in the future. So, but anyway, no, we're not going out in the testing van right now since we're trying to reduce the amount of COVID-19 transmission that's going on in our communities. But we have been compiling a lot of resources around HIV and STI testing that we'll be sure to get out there as soon as they're done. We do have also a phone number. Here, I can definitely put this again too, that people can call. It's actually it used to be our PEP hotline, where people could call and ask if they had any questions about like post-exposure prophylaxis for HIV or PEP, that's what it's short for. That we're actually transitioning to being a COVID-19 hotline too. So you can call and someone from our community health department will pick up and you can get some counseling about your sexual health and your risk reduction there. Oh, I definitely mispronounced Rama, or not mispronounced, but probably said it in my like New Jersey accent. So that's the last name, Rama. Yeah, there we go. We got our phone number down there too. So 202-797-4439 is going to pop up. All right. Should we dive on into talking about some of our resources and what's been going on? Definitely keep leaving questions in the comments below there, y'all, because we'll be answering those.
Yes.
All right. So I would say for all these resources that we're about to talk about, a great place to look for all of them is on our website. So Whitman-Walker.org / COVID service updates is where you can find kind of like the most up-to-date information about what services we're offering during that pandemic. We're learning a lot more about the pandemic as it goes on. And we want to make sure that we're doing basically like the most good for our community while also keeping everyone safe, keeping our own workers safe. So we're constantly updating that as we go. We got a question saying, do I have to be a Whitman-Walker patient to call? No, you do not have to be a patient of Whitman-Walker to call that hotline. We are offering it for free to anyone who feels like they need to ask a question to our community health team.
Mm-hmm.
All right. Shall I talk about the respiratory clinic?
Yes.
Cool. So, big thing, the biggest change that we've been talking about on our last few lives with Whitman-Walker is that the only really in-person appointments that we are taking are for our respiratory clinic. So what that looks like, it's at our 1525 14th Street location. So that's like our main clinic location, and as well as our Max Robinson Center, which is down in Southeast. So if you're experiencing a possible symptom of COVID-19, so those three include a fever, so anything more than like 100 degrees, a cough, or shortness of breath, you are encouraged to call us. So you have to be a patient of Whitman-Walker. But if you are a patient, like you've come to us before, we have your information, then you have to call us basically before coming in. It's not a walk-in service. So you would call us to schedule an appointment. And that phone number is 202-745-7000, so 7000. We'll schedule for an appointment. It could be a same day appointment, it could be the next day appointment. So it's not like you're going to wait for like a week, 10 days sometimes for like other doctor's appointments work. And then we'll talk to you over the phone, see possibly what your risk is of like, do you have COVID-19? Do you not? We'll talk about your symptoms. And if the provider feels that you should come in to be evaluated, then we'll put you on for an appointment, and then you'll come in and talk to a provider. And we do have some testing capacity too, basically for people who get a negative flu test and are presenting some of those like characteristic symptoms. Um, and then the last thing to note about all of that is our pharmacy. So our pharmacy is mostly encouraging everyone to use our delivery service. So we have a delivery service with our pharmacy where it's actually like you can get your prescriptions like delivered to your front door, because we want to reduce the amount of people who are coming into our clinic. But we know it's also important to make sure everyone has their prescriptions. So definitely make sure you're contacting the pharmacy to make sure you're signing up for the delivery services. But if you do need to come in for whatever reason, the lobby itself for the pharmacies, both at Max Robinson and at 1525, is closed. But we do have pharmacy workers there who can actually like meet you out on the sidewalk to like give you your prescription. But we want to reduce your exposure. We want to reduce their exposure. So like definitely try to get it delivered if you can. That was a lot. Are there any questions? Definitely drop any questions about the respiratory clinic, because I can definitely answer those, because it's a new thing, the weird thing, but we're helping for sure.
This might be one of the questions. Say I had come into Whitman-Walker for some sort of testing
Mm-hmm.
um, in the past. Would I qualify as being a patient of
Yeah.
Whitman-Walker?
So as far as I know, yes. If you come in for an appointment, especially if you have a primary care, um, if you've gotten primary care, you've seen a provider there before, then definitely yes. Unfortunately, if you have only come in for say like HIV or STI testing, then you wouldn't just count as a patient, because you don't. We basically, those are like free services.
Right.
Um, and we would need some sort of like insurance information for you to count as being like a patient or whatnot. But if there's like a murky area, or if you're not sure at all, definitely give us a call there too, because we can still evaluate you over the phone. Possibly we could see if you could talk to one of our community health workers, obviously, who can help you out with a lot of different resources that are going on in the city. So if you're not sure if you're like count as a patient or not, because it can be confusing, give us a call, because then we can definitely determine that and get you the help that you need. That was a good question. Thanks, Sol.
No problem.
So yeah, so otherwise, besides the respiratory clinic, we've been doing telehealth things, right? So that's been a whole transition too. Do you want to talk a little about like what telehealth has been looking like at Whitman-Walker?
Yes. So as far as telehealth, um, you do need to be an active Whitman-Walker patient because of the way that you're going to receive your care. You can find
Mm-hmm.
more instructions on the website under telehealth, but basically you'll need your patient portal account with your active email address, and then you'll create the patient portal with either your smartphone or a computer, and something
Mm-hmm.
that has access to a microphone, because you'll be having conversations with your physician, your care provider. And in some cases, they'll email you or text you a link to automatically just join your telehealth appointment, which will probably be like a video call or a phone call. So you'll need your patient portal to log in for that. The services that are being offered on telehealth are as follows. I won't say all of the numbers, but if one that you feel jumps out that you need me to say the number for, please comment in the section below. The services that are on telehealth are emergency PEP services, PrEP clinic, those newly diagnosed with HIV, entering HIV care for the first time, the Gay Men's Health and Wellness Sexual Health Clinic, medical care, behavioral health, which is therapy and psychiatry, legal services, research, public benefits, and insurance navigation, care navigation, gender affirming navigation, youth care navigation, peer support, and nutrition. And we just ask that you be completely patient with us, as this is not only new to you guys, it is new to the healthcare providers as well. And they're all
Definitely.
learning as we go.
That we are. I think we've gotten better. We're entering, it's not like our first week anymore. So I think we're getting a little bit more used to it. But yeah, be patient. We're doing our best. Everyone's doing their best. Um, I can talk a little bit because those are our services that are on telehealth. And again, if anyone needs the phone number for any of those services, like we have it here. We just don't want to like spam you with all these different phone numbers. So like just ask and we can give you that. Also, it's on our website. Um, but some of our services we have had to put on pause. So first one I'll touch on is our gay men's health and wellness clinic, also referred to as like our sexual health clinic. So what that is, it is doing some sort of telehealth things, but I think more importantly, we're starting to roll out a phone number that people can call if they think they're experiencing a symptom of an STI or have a known exposure to an STI. And what a known exposure is that someone else that you've had a sexual encounter with has been did test positive for an STI, so something like syphilis, chlamydia, or gonorrhea. So if you think you fall into one of those categories, you're having some symptoms, you've had sex with someone who got tested positive for something, you can call our number that I think it was posted by the Whitman-Walker page. So it's 202-745-6175. And then what they can do is they can coordinate like next steps for possibly getting you treatment. So if you are a patient of Whitman-Walker, you can do this. Or if you've ever been to the evening clinic, so our evening clinic is a free resource. But if you've been before, they already like have all your information and stuff. So if you've been to the evening clinic before, or if you're a current patient, then you're eligible to call, talk to them if you do think that you need to have a conversation about like an STI exposure or symptoms going on. So they can't do routine testing, unfortunately, and they can't start people on PrEP like they usually do. But they can still possibly offer treatment to people through our pharmacy and like that whole delivery service. So I think that's an important thing to note, since it's like kind of telehealth, but also like they're trying to do some other things with like the phone number and stuff. So just so that's clear. And the other weird thing, the other thing that I should talk about is like if you come to us for your routine lab work, kind of what that looks like. So we're encouraging people to instead go to their nearest LabCorp location in their communities, since we're not able to offer routine lab work going on right now. Other places that are closed, so our youth services at Eastern Market are currently not open. All our services and programs at Liz, which is like our nice new complex, also on 14th Street, that's not open. Walk-in HIV and STI testing is not. All of our events that we did, so we talked about like the mobile health before, and how the van is not going around currently, so that's all closed. And then you also mentioned the corner right now, also not being open. So those are the things that are closed for now. Last thing I'll mention, I emergency P. It's scrolling. Are you still there? Sorry. Some connectivity issues. But our PEP line, is, like I said, is now COVID-19 hotline. You can call that, I would say, is 202-797-4439. I'll put that in the comments just real quick. PEP/COVID hotline. And anyone who can call that for counseling. 797-4439.